Hello.
Yo, sir.
Hello, darling.
Okay, I need help settling this debate here. So,
Mm-hmm.
because YES spells yes, how would you pronounce EYES?
What?
Say it again.
Because YES spells yes, how would you pronounce EYES? That's ES, right?
Eyes.
It's eyes.
EYES. So you're talking about the word eyes.
That's ES, right?
Eyes.
Okay, well, never mind then. Oh my god, I can't get nobody with this, bro.
Why are you trying to? You're literally spelling the word eyes.
Alright, ladies and gentlemen, in case it wasn't blatantly obvious, this video presentation is about the eyes. Known to some as the windows of the body, the eyes provide living organisms with the ability to receive and process visual details such as color, depth, and contrast. It's how we're able to drive, play games, and watch movies. To some, vision is seen to be more important than hearing, and most would rather be deaf than blind. Well, at least according to this Reddit thread I found, but you can decide that for yourself, I guess. But with all this talk about the eyes, how exactly do they work? Well, it all begins with an image in the presence of light. When we look at an object, the light that is reflected off the object enters the eye through the cornea, which is the clear front layer of the eye. The cornea's main job is to bend light rays before it passes through a watery substance that fills the area behind the cornea, and this is called the aqueous humor. Then light continues to travel through the opening in the center of the iris, which we call the pupil. The iris, on the other hand, is a colorful part of the eye. It's either blue, green, or brown in appearance. Also, the pupil can automatically get bigger or smaller depending on the intensity of light present. This is called dilation when it gets bigger and contraction when it gets smaller. Moving along, light passes through the pupil to the lens, located directly behind it. The lens is responsible for adjusting its shape to bend light and focus light rays a second time. This is to ensure that you have a clear image of the object in focus. Next, light passes from the lens through a clear gelatinous substance called the vitreous humor and reaches the back of the eye. The back of the eye is called the retina, which is a light-sensitive layer that contains photoreceptors. Photoreceptors are made up of rods and cones, and are responsible for transforming the light rays into electrical impulses. Rods are responsible for vision at low light levels, and cones are responsible for vision at high light levels. The light from the object that we initially saw is focused specifically on the fovea. The fovea has a high density of cones, which is why light needs to be focalized on this portion specifically of the retina. Finally, the nerves of the retina collect the electrical impulses from the photoreceptors and then travel through the optic nerve at the back of the eye and reach the brain, which processes the signals into an image. Simple enough, right? As you can see, the pathway for vision is very in-depth. So naturally, if one of these structures in the eye were to malfunction, it would result in poor vision. One of the most common cases is myopia and hyperopia, otherwise known as nearsightedness and farsightedness respectively. There are roughly about 3 million cases yearly in the United States, and this is often due to either old age or genetics. In myopia, the lens converges light rays before it reaches the fovea, which means that someone is unable to focus on an object that is far away. However, they are able to focus on objects that are close by, like reading a book. Hyperopia is the exact opposite. The lens converges light rays after it reaches the fovea, meaning that someone can focus on an object that is far away, but not objects that are close by. If you notice, both of these conditions involves the lens. Most vision conditions occur when the lens loses its flexibility, and as a result, we have difficulty focusing on objects. But with that said, there are solutions to help treat people with myopia and hyperopia. The first solution is corrective lenses, which ensures that light rays converge directly on the fovea. The second option is contact lenses, which are placed directly on the cornea, and they also make sure light rays converge appropriately. The final option is LASIK, otherwise known as laser eye surgery. LASIK surgery utilizes a laser to reshape the cornea to improve vision without the use of corrective lenses or contacts. However, there are some cases where corrective lenses can't fix vision. An example of this is blindness. Blindness can develop in a few ways, such as cranial injuries, staring at the sun without sunblock, or pouring an entire gallon of bleach into your eye. Yeah, like everyday mistakes. But most cases of blindness are developed over time, like with aging. When parts of the eye age, they fail to perform effectively. Types of blindness include retina deterioration, optic nerve damage, and clouding lenses. Macular deterioration is a type of retina disease that involves the gradual destruction of nerve endings in the retina. This is crucial for sharp central vision, and people who have this condition often deal with blurring and blind spots in their central vision. Glaucoma is an optic nerve damaging disease, which occurs when the fluid pressure inside the eyes slowly increases. The pressure buildup damages the optic nerve, which causes a decrease in peripheral vision. Cataracts occur when the lens becomes cloudy. This causes blurry vision, faded colors, and problems seeing through a glare. Tragically, cataracts is the world's #1 blindness cause, and more than 22 million Americans have cataracts in one or both eyes.
Yeah, so what about those people with walking sticks and the dark glasses who can't see anything? Like that piano guy and that other piano guy?
Yes, a common misconception of the term blindness, but this type of blindness is known as total blindness, and people affected can only see darkness. Total blindness occurs in 10% of people with eye disorders, meaning that most people who have a type of blindness at least have some level of vision. So I've been talking about blindness for a while now, and it was all to set up the real topic of this presentation. I know it might sound far-fetched, but what if I told you that there was a cure for blindness? I mean, this is in no way a legit cure for blindness, but rather just a way to improve vision in people losing their eyesight. One of these methods is by using retinal tissue from stem cells. Essentially, stem cells are special human cells that are able to develop into many different cell types. This can range from muscle cells to brain cells. In some cases, they can also be used to fix damaged tissue. So in this method, researchers decided to use mesenchymal stem cells, embryonic stem cells, and induced pluripotent stem cells for vision defects. And the types of vision defects they would be testing was retinal degeneration, optic neuropathy, and glaucoma. Preclinical trials were performed using animals and the 3 types of stem cells. The results were promising enough, so they decided to move to patient clinical trials. The clinical trials performed also utilized the 3 types of stem cells, and the results showed that most patients noticed an immediate vision improvement after receiving the transplant of stem cells. Okay, great, so stem cell transplants cures blindness. Someone tweet this at CNN and get this on the news or something.
Psych! Congratulations, you played yourself.
Although the clinical trials showed promising results, the future health concerns still remain to be tested. Some patients noticed that their vision reverted back to before transplantation even occurred. In other patients, there was induced retinal damage and severe inflammation. And these side effects were noticed months after initial transplantation. Nonetheless, stem cell therapy remains as an excellent option for the treatment of blindness in the future. And further methods to improve treatment consist of altering origins of stem cells and developing new ways to effectively transplant the stem cells into the patient. Another method of treatment involves the cornea. Millions of people around the world have impaired eyesight because of damage to their corneas. And even though cornea transplants are well known, they actually aren't enough corneas to go around. Either because, people are still using them, or because they choose not to donate their corneas after death. But a research group in Sweden say that they developed a solution that can address the cornea transplant problem. Bioengineered cornea implants. Get this, it's made from pig skin. Literally could not make this up even if I wanted to. To develop the cornea implants, researchers used medical-grade collagen derived from pig skin to create a transparent hydrogel. Surgeons would then make tiny incisions in the patient's cornea to insert the hydrogel. which would help thicken and reshape the cornea to restore its functionality. This method actually only took 30 minutes, as compared to a typical cornea transplant, which would take up to 2 hours. A small clinical trial was conducted with 20 patients who had blurry, distorted vision. 14 of the 20 participants were blind before the procedure, but regained some or all of their eyesight after getting the implant. And interesting enough, 3 of the blind patients actually achieved perfect 20/20 vision after the implants. Ayo, who would have thought that pork rinds could give you perfect vision? Not I, that's for sure. And this final method I found is my personal favorite. Rather than using cells or other living organisms, this method utilizes technology, which we all know is constantly evolving. A research team in the Netherlands called Nestor is currently developing an AI implant to give sight to people who have lost their eyesight. This AI implant is a microchip that is implanted into the brain and serves as a neuroprosthesis and will link directly with camera glasses. This essentially will bypass the eyes completely, allowing the cameras to send signals to the brain microchip and process images for sight. The technology is still new and has yet to be fully tested on humans. However, they have already begun development with the cameras and are coding software to translate images into dot patterns. So it will definitely be a while until they are able to create images in 360p resolution. But anyways, we can sometimes take our eyes for granted and push them to the limit. I'm talking iPhone on max brightness at 3 a.m. kind of torture. Come to think of it, I'm sure that's why they even came out with dark mode in the first place, no cap. Trying to save your photoreceptors from being Thanos snapped or something when you get a notification. Regardless, our eyes are very important, so we should all try to preserve our eyesight for as long as we can. Eating fruits and vegetables is a good place to start for keeping your eyes healthy. Foods like carrots, spinach, kale, or collard greens are good options for your diet. Maintaining a healthy weight is important too. Being overweight or obese actually increases your risk of developing diabetes and other systemic conditions, which can eventually lead to vision loss. Making annual appointments to see an eye doctor is important as well. They can detect early development of disorders and advise you of what to do next, so it's good to see a doctor so that they can keep you up to date. Surprisingly, smoking is as bad for your eyes as it is for the rest of the body.
Really?
Research shows that smoking leads to an increased risk of developing eye-related macular degeneration. You can also wear shades, even if your future isn't that bright. I'm kidding, but real talk, sunglasses can block out up to 99 to 100% of UV radiation. Lastly, you should try and give your eyes a rest. Looking at screens for long periods of time causes eye fatigue, so be sure to take breaks now and then. A good rule to follow is the 20-20-20 rule. Every 20 minutes, look away about 20 feet in front of you for 20 seconds. This short exercise can help reduce eye strain. So yeah, I guess that's everything I wanted to say. I hope you enjoyed this presentation and I hope it taught you something about eyesight. And before you go making any assumptions, I obviously have some sources, so I'm about to plug that in right here because I'm not some kind of petty plagiarist. I mean, look, you can clearly see it right here. But yeah, that just about wraps up this presentation. And in conclusion, I'd rather be deaf than blind too, just saying.